Okay, we're
Hi
recording.
there.
Hi.
How are you doing today?
Good. How are you?
Good. So this is Elena Anadolis. And do you want to introduce yourself?
So I am a disability rights advocate, and I work with Columbia University Medical Center to help patients kind of navigate the hospital setting and also to try and create community within that particular setting, as well as advocate for others in different types of settings and do disability awareness campaigns for non-for-profits. I met you guys
Cool.
through Instagram, I think, right? You
That's
started
right.
following me.
Yeah, I followed you because I saw some of the PSAs you did for Cerebral Palsy Foundation, which I think was a couple years ago, and I followed you after that. And
Yeah.
then I asked if it was you, and I was going to share one of the videos from them. And then I asked if it was you, and then we became best friends immediately because you messaged me
Okay.
back. And
See, there you go.
I think that's the
And we've
story
been
we're going to go
talking
with.
every day ever since.
Yeah, like a week ago, but yeah, okay. But so for April is occupational therapy month. I'm an occupational therapist, and I feel like uh it's an awareness month, right? And I think one thing that OTs really miss during occupational therapy month is client voices. I think that all of the talk about outreach and all of the talk about advocating for the profession really has to start with the people that we would be able to serve, the populations that we would be able to work with. So I wanted for OT month this month to talk with individuals that had occupational therapy either currently or in the past. Most people that I've found had OT as kids, and so I'm really interested to hear what your experience has been and kind of what your opinions are on occupational therapy, things that we do really well and things that we could do better.
Okay, so I've had occupational therapy since early intervention. So since I was about
Mm-hmm.
3 months old. Obviously, I don't remember it then. My first memory of physical therapy, occupational therapy, was when I had my selective dorsal rhizotomy. Um, that's when they started teaching me how to dress
Mm-hmm. How old
myself.
were you when you had that done?
Three. I was three. So they taught me ADL skills, dress myself, brush my teeth, brush my hair, potty training. So
Mm-hmm.
I've experienced uh, occupational therapy in the hospital setting, school setting, and at home.
Wow.
So
And how? What's the most recent? So from age 3 months until are you seeing an OT currently?
no, the
When was the
it,
last?
it stops when you're 18. So when you're out of the New York City Board of Education, unless
Right.
you go to a day program and then they continue it. But since I went to college, you know,
Right.
it stopped.
Yeah. Yeah. That's a whole nother issue. We're gonna try to get through some questions first, and we'll put that video probably on Instagram, and then we'll keep talking. I have my brother Dexter here. He's done some occupational therapy too. You guys are
Hi,
like
I don't
CT
know you,
buds.
but hi.
Yeah.
Joking.
Um, and I was hoping to have more of like an unstructured conversation, something a little longer that we might be able to upload to YouTube later. Um,
That's
so,
fine.
what would you say? What is your definition of occupational therapy? If someone asks you, "Oh, you do occupation, you've done occupational therapy," what is that?
My own definition is let me think. A therapy that helps me overcome my physical and fine motor skill issues that help me live more independently.
Okay, perfect. I like that. With OT, the big thing, one of the biggest things they teach us in school is elevator speech, being able to explain it really short. So I'm trying to see what people have been told, right? And then you kind of talked about your personal connection with OT already. So when did you get OT in home? So I heard early intervention and then school setting up to age 18. When did you have it at your house?
So what they did was they would pull me out of my classroom or times to socialize with my peers in school. So what my mom got um
Mm-hmm.
something called an RSA, which allows therapy at home, and so that they wouldn't it
Okay, because
wouldn't
she
interfere.
didn't want you to be pulled out.
No, she didn't want me to be pulled out. At first, I was pulled out for physical therapy and occupational therapy. I was pulled out during recess, during lunch, during times where, obviously I needed to socialize. So she brought it to the house. Um, Depending on which I've had in total, not counting the hospital therapy OTs, about four occupational therapists, which isn't bad for an 18-year period. Um, so yeah, that's when I first started. Did you guys freeze on me? I think you froze. You froze. Okay, you're good.
So we had technical difficulty because of I had my phone on my dashboard and it heated up too hot. But this is still a successful meeting. I still declare this to be successful.
What you were talking about was her experience in school. She said she had whole, I forget the
She was
Yeah.
she was they were doing pull out on your therapy at school, and so your mom set it up to where they could come to the house, which is awesome.
Yeah, which is
Okay.
really good. I've had about four occupational therapists my whole life, which I think is pretty good.
Yeah.
It's pretty consistent, and I noticed that with each OT worked on different things.
So what did some of your therapists work on and why? Let's talk about maybe at the end. We're really interested in like toward the age 18. What do they work on with you toward
Okay,
the end of your time in OT?
so here's a story. My occupational, I keep saying physical, my occupational therapist in kindergarten. I had her from kindergarten through third grade in school. And then
Mm-hmm.
when I was she would work on like typing and sewing and things like that. What happened was I ended up connecting with her again when I was 16,
Okay.
maybe
Did she
15
still work?
earlier.
Did she still work in the same district and you were in the same district too?
No, it just so happened. So with this particular, I'm gonna call it a program or permission that my mom got for me to have therapy at home. I could pick any therapist that worked within the board of ed that I
Cool.
wanted to come to the house. So then she became my occupational
Okay.
therapist again, which was really really cool. So we
Yeah,
just
that's
kind of continued where we left off.
okay.
She taught me my basics when I was younger. I mean, we really didn't have much to work with in school. There's a lot. There's the typing, there's the cutting, you know.
Mm-hmm.
Um, there's the writing. Back then it was a typewriter. At first I had
Wow.
therapy in a bathroom because we didn't have a room. Then I had therapy in the back of the stage in the auditorium in the dark.
Mm-hmm.
And then it switched to my house, which was wonderful.
Which was much better.
Yeah, much better. The cool thing with her is she was friends with my physical therapist. So we would go on outings together, and depending on where we would go, obviously she would either teach me a skill or I would work on one particular skill. Like on Saturdays and Sundays we went to a swim class, and I wasn't used to
Cool.
standing and showering, but the
Right.
space was small enough for me to do it, and there were bars. So she actually taught me how to safely stand and shower. So I didn't need
Wow.
a shower chair.
That's
Yeah, which we were in our bathing suits, but and she's like, you're gonna
yeah.
place the soap here. You're gonna do this. If you think you're gonna lose your balance, grab onto here. You know. What else did
Do
she
you
do?
know her name? Do you want to shout her out?
Yes, Lynn Hinman. Amazing. She's actually in Kansas right now.
Oh, cool. I'm gonna turn
But
on my car. getting hot. Okay, hold on. I'm just gonna crack these windows. This is
So
not the isn't the world's best.
yeah. So Lynn
What'd you do?
Hinman. So when we would go out, we would socialize. She became more like family.
Absolutely.
I think when therapists come to the house and you know do a continuum of care with and work with another therapist, they become family.
Absolutely.
Before I had my hip surgery, we planned and we set up my room.
Mm-hmm.
We went through the steps and we're like, all right, you're gonna have hip surgery. What are you gonna need? Where are you gonna need it? Where are you gonna need the bar? How are you gonna transfer? She got me ready for surgery. After surgery, she came again and she retaught me how to dress myself while I was in pain.
Right. So much.
Not that I didn't know how to do it, but it's different when you have surgery and you're in pain and you can't move certain limbs.
Right. There's so much here for you and to talk about. I want to ask you one last question, and then we're gonna open up like more of a conversation. What would you say if you had one piece of advice to give to occupational therapy practitioners, based on your experience? What piece of advice would you give them?
Look at your patients, listen to them, ask them.
Tell me more about that.
And ask them what they want to work on, what their definition of independence is, and then take it from there.
And can you kind of that's really, really good. I love that answer. Can you tell us why that's your piece of advice, or kind of bring it home, bring it personal?
It's about the patient. It's not about anyone but the patient. And your goal in occupational therapy, at least for me, is to make that person independent. Everyone has their own definition of the word independent.
Right. Have you had therapists that did both, or can you tell me a little bit about your experience about why that's your advice?
Because different therapists worked on different things. I really didn't think that it was very much important to sit there and work on typing.
Right.
And how many words a minute I could type, as long as I could type. I also had an occupational therapist who called my mom up and said, you're a horrible mother. Why are you giving your daughter false hope? Because I'll tell you why. Because she saw by my hands that based on my pinky finger and the movement of my hands, that I not only would never be able to type, but doing my ADLs would be almost impossible.
Oh no.
That's a very large judgment to make.
And I was just
pinky.
Because of a pinky.
I'm trying to stay quiet so you guys can talk.
No, well,
no,
it's okay.
Okay, so
giving you false hope. That's sick.
Yeah. She was. How could she do that to me? How could she give me false hope to think that I would be independent and type on a computer, because my hands aren't working and I would barely be able to do anything for myself, or if I was, it would be with great difficulty.
Do you even need to be able to type on a computer? Is that?
But the key? But she expanded it to dress it.
Yeah,
what she meant
was
your typical ADL skills.
Here's you.
Sorry, I'm trying to fix this.
What are you doing? I'm trying to listen to Elena talk. Okay. Fix what thing? Sorry. Okay, yes. This is some serious. This is the most serious, most professional meeting you've ever been to. But anyways,
so
we really appreciate you talking.
Let's focus on what the patient wants.
Yeah,
and depending on what the setting is. Like when I went into the hospital, because I already knew how to do stuff, because I had my therapist before and I had my therapist waiting for me at home, she didn't know what to do with me. She's like, well, what can I help you with? And I'm like,
nothing.
Nothing really. So
I'm gonna do what I do. You just smile and nod when I do it.
So we practiced, what we did? We practiced cutting salad.
I like it.
Items.
I guess. Might as well.
Practice peeling. Oh, no. To be fair, I wasn't really good at that,
That's okay.
So at least I did learn something.
So I think we'll bring Dexter in. It's been over, like, we'll have to cut this for Instagram. It has to be less than 10 minutes. So how are we gonna bring you in? Can you relate to anything that she said?
I can relate.
You guys can kind of talk.
I can relate to a ton of what she said. It's been hard to kind of keep my mouth shut during a lot of it because it sounds so similar.
You've been doing a really good job.
It's been hard, man. It's been hard. But yeah, it's so funny because, like you're saying, they listen to the patient, let them decide where you go. I think a lot. I think your experience with your other two, where she has you type it, and you're like, what is even the point of this? I've ended up there a few times with some therapists, and most of the time when that happens with me, or the one that I most distinctly remember, it was like I would try to talk to the lady, and she just would not hear it at all. Like, she had her idea, we're doing her idea, that's where we're going, and she was not interested in what I had to say. As far as that goes, I don't think everybody's like that, and I think attitude makes all the difference, because flip of the same coin you just talked about.
Well, Elena, can you relate? Elena, see, I'm doing the wrong name.
It's okay.
Can you relate to what? Do you feel like you've had that feeling from therapists before?
No, because I opened my mouth. Even from a very, very young age, I was just like, "Hey, this is what I want to do," but I would ask them what they thought.
Mm-hmm.
So I was one of those patients or students where I'd be like, "Okay, this is what I think I should do. Like, what do you think?"
Mm-hmm.
So I mean, I thought typing was important at the time. I was like, "Oh, computer, cool,"
Right. Have you ever felt dismissed? Like someone was being dismissive with you?
From an occupational therapist?
Yeah.
No, more clueless.
More
Clueless.
like not sure what to do with you.
Yeah, because I don't like to use the term, and Dexter and I have spoken about this before, but we used it anyway. I was so high functioning that she didn't know what to do.
How to help you.
So
I didn't mean to cut you off. I just wanted to have a chance for her to talk.
You're good.
What else did you identify with?
Just trying to find things, like having to, because I didn't really think about it in the moment when I know what I was gonna ask. Sorry, that ADD kicked in. You talked about having OT in school and then having it later on. Can you describe the differences in approach between those two things? Because I only had it at school.
She only had it in school too, right?
No, I had it at home and in the hospital.
Okay, but all under age 18, is that right?
Well, through 18.
Right. Okay, go ahead.
In school, it was more school-based things, like the typing, the writing. They would stick me, for whatever reason, they would stick me in a prone stander and have me eat lunch standing up. I thought that was a PT thing, but whatever. Like, it was weird. Like, again, the cutting of the shapes. I still can't cut. My cutting skills are really bad.
I remember that. That was a pain in the butt. Yeah.
Yeah. Do y'all use it? Do y'all use it at all?
I don't.
Kinda, sorta. Like, my dad will make me, like, when I have to, like, send stuff back to Amazon, like, he'll make me cut the label just to practice.
What would you do if he wasn't there? Like, if he wasn't there to make you do it, how would you do it?
I would take the straight edge of a table and fold it and just like rip it along the lines. And then if I didn't like it, I would just cut. I mean, I'm better with steak though. I can't do like meats and stuff. No, I'm being
motivated.
No, I can still do it. When I go out, I'll ask them to cut it just because I don't want to be embarrassed. But yeah, no, I still have my issues. But I'll still do it. My dad will be like, "Let me do it for you," and I'm like, "Nope, I'm gonna do it."
Yeah, that reminds me of
because I can't, for whatever reason. I don't know about you, Dexter, but for whatever reason, whenever I have a knife and fork in my hand, I have a tendency of wanting to pull instead of saw.
Yeah.
So I'll like kind of pull with the fork and the knife instead of actually going back and forth and using the fork to stabilize it. I don't know why. Maybe it's a wrist thing. Who knows?
Do you cut? Do you cut your food?
I can, yeah.
Okay.
I don't do it very often because it's slow and tedious.
Yeah, I get it.
Yeah,
but,
exactly. It takes time, and then sometimes you have food flying off the plate.
It's like that. That's all part of the plan. I was feeding the dog.
He does stick close to you.
But the difference between school and home. Home, we worked on more functional stuff. Like she taught me how to put eyeliner on, which I totally forgot to do. She taught me how to sew, taught me how to shave my legs without cutting myself.
Wow.
We actually
That's
went. This is not an OT related thing, but the coolest memory that I have with her is we went skiing. Oh, we went not skiing, ice skating. So she has a brother who's a big hockey player. So they actually took me and they stood me up and had me. They both were holding me up and we went ice skating. She's like, you're gonna experience this. I said, okay.
Yeah. Occupational therapy is about meaningful occupations, like meaningful ways to occupy your time. So going ice skating would definitely fall under that thing. It's about rec exploration.
Yeah. So
there's a field there.
She took me ice skating, which was really, really cool. Like that's the one thing that I remember. You
were saying that and I was very dismissive about this in the last video, but you said that therapy through your school had a arrangement with the Gulfarium to be able to go see dolphins.
Yeah.
Do you want to talk about that?
I don't really remember much because they set it up and I was like 10. So like they kind of set it up. We're like, here. One of the I cannot remember her name. I have a feeling like one of them's gonna look back at this and be like, how could you forget?
Yeah, when this video goes mega viral, you're gonna get in trouble.
It's whatever. So I grew up in Florida, which is like, they're all about the water. They had a program they did when I was about 10. It was like right before school started. They brought me in and they had me help train dolphins. So that was pretty interesting.
Cool. That's different. That's cool.
Did you get to feed him a fish?
I fed him a fish. I taught her how to brush her teeth. I taught her how to do like that weird back flipper thing that they do, like the dance that they do. Taught her that. I taught her how to play fetch. It's pretty interesting.
Yeah.
That's it. And her name was Daphne. That's pretty bad that I can remember the dolphin's name, but I can't remember the OT.
Well, you've met a lot of OTs. You only met one dolphin.
I don't know what that says, but
there you go.
I liked what I paid very close attention to some of the services that you were talking about in school, like that you had therapy in the back of the dirty gym or the dark auditorium, and pull-out method is something that they're taking kids out of the classroom like that. It's not what it's called. Well, it's kind of what it's called, but not. We're just going to be awkward about the fact that I just said that. But anyways, so but they're trying to get away from taking kids out of the classroom like that, and because of what you're describing. And so now they talk. The OT is supposed to come into the class and integrate. So she may run, or he, not discriminatory. Somebody may run the small group, have a group of, several kids that either have OT or don't, and run like a fine motor kind of station in the classroom during centers, that type of stuff. They're trying to look at ways. Honestly, a lot of what OTs do in school now is consult. Like how often did you have a therapist? Weekly or?
Well, my
daily?
mom was crazy. I had PT and OT 3 times a week, so.
That's amazing. I mean, that's unheard of.
Yep.
It's probably unheard of then, and it's definitely unheard of now. I mean, there's kids that get OT 120 minutes a year.
Yeah, no. Now, I also had a situation where the OT would come in for certain services, like an occupational therapist. I got a laptop computer and a voice recognition program for school in order to take my
to evaluate.
The OT was the one who the OT was the one who trained me on the voice recognition program, And the one who came to evaluate me was also an occupational therapist.
Right. Okay.
I
So
forget what. Don't you call it ADLs the life skills stuff? Isn't it?
Yeah, activities of daily living.
activities daily living.
Yeah, I don't know all the technicals. I appreciate you guys because I'm like trying to catch
You're
up.
learning new things.
But
he's learning.
Didn't you go to any of your IEP meetings?
You guys didn't know the name of that either.
Oh, really?
Yeah, individual education plan. I do know one. I know one.
Do you think that there's things that your therapist should have done to empower you more?
Lynn? No, I think she did a great job. I wish I had her back now to like teach me how to like at least like with the cooking or at least like different gadgets and kind of get my kitchen set up so that I could do things safely because that's a major issue. I think
Right.
she did a great job. I would have liked, which we didn't get a chance to do only because she moved. I would have liked her to teach me how to do the driving, adaptive driving.
Sure.
As opposed
how did you learn to drive?
I don't.
You don't drive.
I don't drive.
Have you ever gone to driver rehab? Now we're getting an evaluation. No, it doesn't.
No, I have not. No, I have not because the only one in New York is like on Long Island, and I would have to like depend on my parents to bring me back and forth, and I don't like doing that. So it's not like on my list, but I would rather.
And New York's a little different. You don't necessarily have to be like, I don't know what part of New York you're in. Sometimes like the East Coast is different. You can get around pretty good without having to be able to drive. Is that right?
Well, no, you can. You could depend on like paratrans and stuff, but I mean, I would have liked to. The only reason is I would have loved for her because she knows how I like think and like my perception and stuff since we worked. So
you trust her.
You know, I trust her, and we worked together for years. You know, so she kind of like. She can take a situation where when I can't do something, she'll be like, okay, Elena can't do it this way, but she can do it another way. And she'll try it first.
Right.
She would try it first. And then she would be like, all right, like I'll give you an example. I couldn't cross my leg I couldn't internally cross my leg like to shave my leg. So she actually sat there, put her foot in the same position that I was able to put it in and did it to herself and then was like, okay, let me show you how to do it. Same thing, like my mom, I know we're not talking about parents, but my mom would do the same thing. So
I think as a therapist, it's important to, and I worry about looking this way in front of my clients, but like sometimes I have to take a step back and figure things out. Mm-hmm. And to some of them, I think it looks like I don't know what I'm doing in those moments. And so that's something that I'm trying to work on, is trying to explain that like, oh, because occupational therapy is so personalized to you and your situation, I'm working through this during this session with you, right?
Well, you're learning from each other.
Yeah, we're learning from each other. Yeah. And that's so key to an effective treatment. So if I have to take a step back during my sessions, I try to like let the person know, like, you know, I don't just have, you know, all your answers in my back pocket. If I want to like sit down and try to figure this out together.
You know,
go ahead. Yeah.
You're finish your thought.
That was the end.
I was just gonna say, I feel like I spend a lot of time talking about how OTs need to listen to their patients, but that on the opposite side is our responsibility. Like if you're wanting OT, you need to have an open mind to be able to listen to your to the OT and try to help them help you. Like
it goes both ways, you know.
Yeah.
And then just I think a lot of people. I think American healthcare especially is kind of set up to like people want something like a pill, or they want something quick.
A quick fix.
And a quick fix and have that certain expectation, especially if they're in the medical system, want something like that. I had a lady come in with neuropathy on her hands and her feet, and she's got diabetic neuropathy and really in bad pain and stuff. And she was asking me, is there any sorts of like simple exercises I can do for my neuropathy? And I said, honestly, no, your best bet's going to be to manage. I said, how well is your diabetes managed? And she said, not very well. And I said, that's going to be your best bet for reducing and like slowing the progress. And that's a whole lifestyle change, right? So she wasn't like prepared for that during therapy, but so she stopped coming. But you know what I mean? So like because occupational therapy is supposed to be your life skills. It's supposed to be holistic. And so I think it's easy to slot in, especially for schools. Dexter and I talked about that on the video that we did for him. But like schools has to be school based. I'm sorry that everything's so loud, but it has to be school based. But that totally limits your ability to do meaningful activities to the kid. And then I feel like in some ways it limits your ability to help them transition out of schools.
Yeah, it's very hard
in order to transition into daily, and that should be the goal of, because the whole point of education is to transition into being a functional adult on all levels. So I don't understand how they can get away with doing what they do.
My therapist is even going to go as far as like letting me stay at her house instead of me dorming at my school, and like be like, okay, now I'm going to teach you how to do stuff, because everything's on the first floor, because my house is 3 floors. So me doing laundry and bringing it up, and it's not.
Wow.
It's not ideal.
Do you have an elevator? Okay, never mind. None of my business.
I don't. But that's how I learned how to walk my stairs. But like she offered, she's like, let me, you can come stay with me instead of paying for the dorms, and I'll obviously like teach you stuff that we can't do at home, because home is
cool lady.
Yeah, no, she's really
Miss
awesome. Lynn Hinman is awesome.
Lynn Hinman. I feel like I'm going to look her up, and I'm going to see that's like, oh, Lynn Hinman, expert of everything, in like she's like a leader in the field or something.
Best of the best.
Yeah,
I don't know, because she went from New York to Kansas, so I don't know what kind of therapists OTs are in Kansas, but I know she probably does really well there, because she has a lot. Wow. She has a heart, and she has common sense.
Yeah.
You were talking about school and how I think that one thing that would alleviate that, because they pigeonhole you, they don't tell you that OT is holistic, they don't even bring that in. So I think even if you have to keep it to this vein, I think it should be required, if you bring the OT in, for them to explain like, okay, this is what we have to focus on in this setting,
right?
But my job is holistic. It requires holistic approach, and present information and avenues for that person to, because there's nothing against that, and it doesn't hinder what the schools want to do.
I hope that they would. And I think there's a real, especially, we're gonna stop here in just a couple minutes. We try to keep things about 30 minutes, but I think therapists that work with kids, I think it's easy to forget that you need to be explaining what you're doing to the child, like not doing to them like, but with like
what you're doing.
Yeah, what are we doing? Yeah, like explain what we're supposed to be doing. Right, yeah. Well, I think you treat. I know a lot of really good pediatric therapists, but even myself, like I tend to collaborate with the mom. And say like, listen, this is what we're going to be doing at home. And like, this is what you're wanting to, this is why we're doing this. And it's hard to scale that up appropriately for the child that you're working with. But every child, I would say any kid that gets OT has some level of understanding to be able to have some buy-in on what you're doing. And I've had children who are nonverbal. I'm not going to say that I can't really make a strong comment on cognition, but nonverbal type kids. And you can tell when you're doing something that's meaningful with them or not. Yeah. Like they may not have a total understanding of why, but they understand that like this is something that they'd like to do and that they'd like to continue to do.
Right. Well, when my sister had my sister also had Lynn as a therapist. She got it.
Mm-hmm.
She would work on more like posture and her being able to like sit up by herself and things, but she got it.
Yeah, and you can tell what's meaningful to everybody. What else was I gonna say?
Smile or whatever, but you knew, you picked up on what those nonverbal cues meant.
Another person that I asked for to help me with this project, she said her piece of advice was to treat children, like empower them instead of making them feel like you're fixing them. And I was wondering if you guys could talk a little bit about that. I thought that was very profound that she said that.
Well, you empower them by telling them that they can do this. You just do it a different way. There's
Right.
always a way to do something.
Mhm.
You just have to be able to think outside the box. And sometimes when you're in our situation, the frustration and the rage of us that comes from not being able to do something kind of clouds that ability to think about it. So go to your therapist and be like, look, this is what I want to do. Can you help me? What are different ways? And then from that conversation, you might say, no, I don't like this. What about this? It's all about being able to communicate. Even little kids are able to communicate, their ideas.
Absolutely.
It's
And they see it as fun. I think I did, at least. I love that.
Yeah, absolutely.
It's fun. Even when
It
a
was-
little kid
If you
asks
have good
about
therapists.
disabilities, even when little kids ask about disabilities, they'll ask, you'll give them an answer, and they'll be like, oh, okay, let's go on and continue playing. So if you have a good therapist and you know what you want to do, have that conversation. Two heads are better than one.
It's the difference between like somebody getting a savior complex and somebody seeing themselves as an ally.
Right, exactly. That's a very good point. And Whitney and I witnessed a savior complex at a recent
Somewhere. We saw that somewhere.
But
and then I remember like when I was in school, when I was in OT school, it didn't occur to me that like in pediatric therapy, what you're doing is you're taking a kid and you're asking them to work on all the stuff that they're bad at. You know what I mean? And you're being like, hey kid, you're still bad at this.
The shoes.
The shoe, yeah, the
I'm
shoes. His was shoe tying. Yeah,
shoe tying, yes. Shoe tying, that was a big one. Or
and
peanut
so
butter and jelly sandwich. Remember? We were on Instagram. I was telling you it took me 6 months to learn how to do it. To say, okay,
Right.
hey, I have a disability. So that means I have to get the plate, I have to get the spoons, I have to get the peanut butter, I have to get the jelly, I have to get the wet paper towel because my hands are going to be dirty. And then there's a sequence. What comes first?
Right.
You got the bread. You know what I mean? That took me 6 months.
Right.
But I did
so like
it.
if you're working with somebody on something that's really like you're working with these kids on stuff that they maybe don't like to do or they don't understand. So you have to like that piece needs to be built in, like that you're showing them, look, you can do this. This can be fun. Or like your mom, if you like showing it, like this might be in the future, your mom might not have to do this for you. You could do this yourself, or like just try to show them.
Because that's all I wanted to do as a kid. I didn't want anyone to, that when I was in rehab or whenever I needed help, I refused it. I said, nope, I'm staying here until I can do it myself. Or until my mom comes so that she can show me, because you people don't know how to do it with patients.
Yeah.
Right. Wow.
And you want to do it instead of showing me how to do it. So nope.
Right.
Do
you have any, we're gonna finish up. Do you guys have any parting thoughts?
Well, we're the coolest and good luck. I'm just kidding.
Who, you and Elena?
Yeah.
And what am I? Chopped liver?
No.
No.
I love you.
Oh, no.
I told you you're part of the family. No. Didn't I tell you? I told you we could share mommy. She already loved you.
Yeah, we're sisters now. So she's our new sister.
Cool.
All right.
That would be really awkward, Dexter.
Yeah, he smells horrible. Anyways,
I showered. What the heck?
Stinky brother disease. Stinky brother disease.
All right. Goodbye.
No, it's
Good
okay.
luck.
Lock the door. Well, we really appreciate the time that you took to talk with us about your experiences with OT. Thank you so much. Thank you for enduring the technical difficulties.
You're very welcome. No problem.
And we appreciate you, Elena Anadolis. A name I can say now with confidence.
Do it again.
Elena Anadolis. I like the way that it rolls off. That's my favorite. Elena Anadolis. It's really good. All right. We appreciate you. Thank you so much.
See ya.
Bye.
Bye.